Hello again. Thank you for joining us. This is Dr. Shoar with Shoar Chiropractic and Acupuncture Medicine, and I want to welcome you to Ask Dr. Shoar. Last segment, we talked about veterans, and of course, we thank them for their services to our country, to our nation. We talked about some of the disorders and issues they develop after serving, whether it's 3 years, 4 years, 8 years, 10 years, depending on the contract they have, whether it's sometimes 20, 25, sometimes 30 years. And I know some guy who served 35 years. They develop issues, joint issues, spine issues that others don't, because the rigorous training and the kind of lifestyle they live while they're serving our country. So that we talked about that. So now, in this video, what I'd like to talk to you about is, what is it that we do that's so different than other places? How is it that our approach is different than other places? Why is it that they're getting better at our office? What is it that we do any different that helps them out and they see the difference? They tell us how much we have helped them out, not only reduce their pain, but also the frequency of pain, how their mobility is better, why they feel stronger, they sleep better, they enjoy life better. They need less of their pain medications. And some are telling me, actually, because they are more mobile. They go into nature. They do things that they didn't do before. They're able to do things with their family, with their wives and the kids and the grandkids. How that's helping them become a better father, a better grandfather, and less dependent on some of these medications that are, for psychiatric medications that some of the issues they've developed from those days serving our country. So it helps them more than just physically. It helps them in so many ways. It's beyond words how much we can help them out. Again, we're there just to help them out and help their body heal itself and heal properly. So that's what I want to go over with you today. What is it that we do that's different? So when I meet with our veterans, first thing I do, I always thank them for their service, and we welcome them back, welcome home, and we welcome them back to our home, because they deserve to be told that they need to be appreciated, and they want them to know that they are at home, they're here with us, we are a family, we're here to help them out. Then I go over the history, where they served, how they served. What are some of the conditions they have developed? What is it that they have developed? And so some they come to me for just a low back or neck pain. Then I ask them, so how's your shoulder? Oh, by the way, doctor, my left shoulder hurts a lot. When I move my arm, it hurts. Or sometimes when I hold my grandchild, it hurts. Or sometimes they say, I do have a weakness in my left leg. So I start digging more into what their issues are. Again, a good, proper history, and also good, proper, you talk to the patient, you got to learn what it is that what hurts them. How's your sleeping pattern? Do you sleep good? Do you not sleep? Do you have a good number of hours of sleep at night? What is it that bothers you? What is it that you're trying to achieve? So a lot of these, I sit down and talk with them, and I take all that in. Sometimes I take notes, sometimes I don't take notes, and I'm going to take all that in. And so when I come with a solution, just because somebody has, back pain, knee pain, doesn't mean that it's, injury to the knees. Sometimes their digestive system, if it's not working properly, if they're not eating proper food, if they're not taking the proper vitamins and minerals that their body's lacking, and thereby they have developed all these ailments and issues, I help them out. I talk to them. All veterans, they get one visit with me. I'll sit down and talk to them about vitamins and minerals, explain to them what vitamins they should be taking. I even guide them to where to get them from, because I don't want them to feel that I'm telling them to take these vitamins and minerals because we're trying to sell anything. I don't do that. It's all about giving them best service, guide them to where they can get the best price, best quality of vitamins and minerals, whether it's from Amazon, whether it's from Costco, whether it's from Walgreens or Walmart or Sam's Club. So we have already done all the research, so we share those with them. So after we take a good history and find out where, not just the low back pain or the neck pain they came here for? What are some of the other issues they have? After that, I do a lot of, and I put their body through range of motion to see how the range of motion is. And of course, we talk about the pain level, when they have the pain, what aggravates their pain, what alleviates their pain. And then also, I do a lot of tests, orthopedic tests, neurological tests, to ascertain as to what is causing their issues. Is it they have back pain because it's a facet syndrome? Is it because they have degenerative disc disease? Is it because they have spondylolisthesis? Is it because the disc herniation or disc bulge? Just because somebody has sciatica doesn't mean that it's disc, doesn't mean that it's soft tissue. It could be any of these things that I just mentioned. It could be any of those causing that sciatica. So it's important to do proper testing, orthopedic tests, neurological tests, to find out what is the source of that pain. Once I do that, I sit down and explain to them why they have the pain they have. I show them with the spine. I educate my patients. This is spine. This is how the vertebrae are. This is what the nerves are. This is what you have. And I explain to them how they have developed degenerative disc disease, how they have developed the facet syndrome, why they have weakness in one leg or both legs. I explain all of those to them. So, and then next, after that, I explain to them what is it that we're going to do for them. And how, once they understand how they got there, when I explain to them what it is that we're going to do, why we use certain machines on them, why we use ultrasound diathermy on the patient, why we use the electromagnetic diathermy machines, why is it that we use the electrical muscle stimulation, hydrocylator, why we do those exercises that I give them. I train the patients a whole bunch of exercises that we have them do in the office, train them, and they do it every time they come into office. I let them know you got to do it twice a day. We give them a copy with pictures, explanation, and there's another sheet that they can keep track of how many times they did it every day. And I test them on that. I quiz them on that when they come back. We make sure that they are actively engaged in their healing process. I want them to be actively engaged, because when they see the result, they feel they've accomplished something. But that's true with any patient for that matter. And then of course, other types of therapy that we do, in addition to all those physical therapy modalities, I do, decompression, flexion distraction, decompression of the spine. And of course, we also do adjustments of the neck, the back, the hip, shoulders, knees, ankle, whatever it is. We do adjustment, making sure that the bones are properly positioned and they are working properly so they can function, because our body is just a machine. All the pieces and parts got to work together just like a Swiss watch, actually, except that it's 10,000 times more accurate than Swiss watch. Everything got to work together properly for us to be able to function properly. And so I hope I was able to explain to you how it is that we do different in my office, why the therapy takes 2.5 hours in my office. Yes, it actually does take sometimes 2 hours, 15 minutes to 2.5 hours, sometimes longer. And that's why we have a lot of rooms for them to stay in the office, do those exercises, do those machines that we put on them, and then they see the result. They see how they're a lot more mobile. They sleep better. All of a sudden they say, doc, the pain shooting down my leg, I no longer have it. That's gone. I feel a lot stronger. I feel a lot healthier. And my wife, I even hear from their spouses how thanking me for helping their husbands, spouse, because they're complaining less, they're more active around the house, they do more. So, and again, finally, I want to thank our veterans for their services. And believe me, you cannot thank them enough, especially our Vietnam veterans. Now, when they came back, they were not properly appreciated, and that wound still hasn't healed. We need to help them heal. And again, I'm sorry for getting emotional, but I want you to know, anything you can do to help our veterans, thanking them see them in the street, see them, if they have a hat on saying they're veteran, thank them. Go shake their hand, thank them for their service. It's because of their sacrifice that we enjoy the life that we enjoy in America. So thank you again. I'm sorry for getting emotional. Thank you, and have a wonderful rest of the day, and I'll see you soon.